Cervicogenic headaches are headaches that originate in the neck, the muscles around your neck, the joints in your neck. They start at the base of your skull and they oftentimes wrap around your skull, even around your eye, usually more on one side than the other. They can be sharp, they can be really achy, they can be very nagging. In today's video, I'm going to give you strategies that you can use that will take you less than 30 seconds to start getting relief for your headache. Check it out. I'm Dr. Daniel Bridge. I'm a chiropractor in Helena, Montana, and this channel is dedicated to helping you with your spinal health, to keep you healthy, to keep you active. Today's therapy is pretty simple. All you're going to need is three things: a thumb and two fingers. We're going to be focusing on the sternocleidomastoid, which is a muscle that is really often involved in cervicogenic headaches. That muscle runs from the base of your skull through your neck down onto your sternum. To find that, turn your head as far as you can to one side and apply pressure against your head, push into your head and push your head against your hand, and then take your other hand and you'll feel a muscle popping out. That's your sternocleidomastoid, or what we'll call the SCM. What can happen is you can get trigger points in that muscle that can cause these headaches. Trigger points are just little balled up sections of the muscle. To find them, turn your head to the side and run your fingers down, these three fingers or these two fingers down, until you find like a hardened part of that muscle, or more likely than not, you're going to find it's pretty tender. Once you find that, take your two fingers and gently turn back so that muscle gets relaxed and just squeeze it very gently. You're going to hold this for, like I said, 30 seconds, up to a minute, but you can get relief in as little as 30 seconds. If you get intense headache from this, you want to stop, but you're just going to lightly hold it and apply pressure that you can handle for 30 seconds to 1 minute. What you're going to notice a lot of times is really shortly that the pain where you're pressing is going to subside, and you're going to feel the intensity of your headache subside. Once you've hit 30 seconds, just turn left to right, lean your head left to right, frontwards to backwards, get some looseness in your neck, bring some blood flow to the area, and work down until you find another one of those trigger points, face forward, and just lightly squeeze that muscle for 30 to 60 seconds. And you'll work your way from the base of your skull all the way down on that muscle to where it attaches onto your sternum. Be light, be gentle, but once you feel like you're on that spot, just that sustained pressure can make a huge difference. They've done research on this. Not only can it instantly bring the intensity of your headache down, but it can bring the frequency of your headaches down too. So don't be afraid to do this 2 days later. I would keep a journal, a diary of your headaches, rate the intensity, how often you're getting those, and you can do this a couple times a day. Do it every other day. Do it 4 days, 4 treatments, and look at your results. And you should see a gradual decrease in the symptoms related with your headache. So that's the first thing we're going to do. The next thing we're going to do is a bit of a stretch for the muscle. We're going to start by turning your head to the side and also bringing it towards your chest. With these two fingers, find that muscle. Once again, if you're having a hard time, press against your hand, find that muscle. We're going to bend forward, which is going to shorten it. And then I'm taking these two fingers and I'm pressing in and I'm pressing down to kind of hold that muscle in place. Then I'm leaning back. As I do that, I shorten the muscle and then I'm stretching it out. And by applying that pressure to the muscle, as it stretches out under the fingers, it's a really good massage. It's going to help that muscle to stretch, to release, and to relax. So I bring it back, bring my head back as far as I can comfortably, and then I'll move down about 1 inch to where I was and do the same thing. And I will work from the base of my skull all the way to my sternum. Those two strategies are going to be a really good way to address those trigger points in your SCM that are causing those cervicogenic headaches. Hopefully that was helpful for you. Cervicogenic headaches can be such trouble. They can be so nagging and they can really interrupt your life. I'm hoping that these strategies helped you today. If not, see your chiropractor. Getting your neck adjusted is probably the number one thing that you can do for cervicogenic headaches. It's just not something that you can do on your own at home. If you have any questions, leave them in the comments. I'm always going to answer those. Let me know which strategy was more effective for you.